Depression symptoms can absolutely correlate to perimenopause and menopause. This is a huge problem that women suffer with, whether it's feeling depressed, whether it's feeling like mood swings, or even increased anxiety, or a combination of the two. Our hormones directly affect our neurotransmitters. Neurotransmitters are like chemical messengers in our body, but highly concentrated in the brain. That's what these medications work on. So, yes, oftentimes the medication can help depression when it comes alongside perimenopause and menopause. I don't think that there's a right way to go here. Medications are here for a reason. We use them in conjunction with counseling, in conjunction with maybe dietary shifts or something like that, just to help and support our bodies through this. Just because you're using medications doesn't mean that you can't also explore the idea of hormones. And same thing, if somebody's already using hormones and the depression is still there, mood isn't getting where we want to be, that doesn't preclude also using medications. So not a right way. It's just the right way is the way that works for you and your goals.
I see this a lot in the clients that I work with is, did the depression symptoms preclude menopause, or have they just sort of at the onset of perimenopause and menopause? Are they more or less severe? Are they,
Mm-hmm.
what are they more specifically? Because depression symptoms, depending on, if you're looking in the DSM, are sort of kind of far reaching and broad. Uh, are the SSRIs helping? Are they causing loads of side effects? Is it depression with anxiety? Is it individual? Just because depression is, it's hard to pinpoint and there's lots of different things to it. And SSRIs, a lot of them do have significant side effects.
Mm-hmm.
Um, and so, it's something worth considering is sort of mapping it out as best you can. Have I always had this? When did it start? How severe is it? If you've not done something, there's the Beck Depression Inventory. There's also another one called the PHQ-9,
Mm-hmm.
to kind of see where you're at and also to scale it. Are they
Yeah.
going away on the SSRIs? Because they should be going down, in from both the Beck Depression Inventory and the PHQ-9, you should be able to see like, oh, I was at a 12 and now I'm at a 9. I've seen this quite a few times where I have women who are in perimenopause, menopause, and they come in and they just feel very flat.
Yeah.
Um, and it sort of gets earmarked, and I suggest that women get hormone testing.
And it's common too for women to go into their doctor with symptoms of perimenopause and get told that they're depressed and get put on medications, especially if the doctor has a bias against hormones or doesn't work with menopause or any of that field, doesn't feel comfortable using hormones. So when I'm thinking about symptoms there, and I'm listening to a patient who comes in with these concerns, I also ask about hot flashes or night sweats, sleep disturbances, brain fog, new onset of feeling our heartbeat in our chest, vaginal dryness or libido shifts, weight changes, hair loss. There's probably more skin changes. These are some things that I think about that if they're coming all on at the same time as depression, maybe isn't depression per se, but mood side effects of hormone imbalance. So that's kind of
Right.
the ones that I explore.
Well, it's funny because when I see clients, I'll often have women would just be like, I just don't feel flat, and I used to want to
Mm-hmm.
do this, and I used to want to do that. And I think to a lot of doctors and psychiatrists, depending on how it presents, it can look, they'll say, oh, well, that,
Yes.
that sounds like depression. You don't want to do things anymore. And then when I dig a little bit deeper, they're like, well, I don't feel good, or I'm like achy, or I don't have any energy. And I'm like, well,
Yeah.
that's not really the same. Not wanting to get out of bed because of depression is not the same as, well, I don't feel good, so I don't want to move. And like, it
Mm-hmm.
is a distinct difference, which is why I'm sort of saying like explore it as much as you can, as much as you're able to, whether that's with a therapist or with just yourself. I would highly recommend it because it
Mm-hmm.
might be, maybe meds are the right way to go. I know, SSRIs can be great and they can be fantastic for a lot of people, but
Sure.
it's certainly worth exploring, like, because if it's not from neurological imbalance, the SSRIs aren't necessarily going to help.
Right. Or they
They're
only help
they're
mood and everything else is still there.
Yeah, or they cause
Yeah.
the side effects of their own. Like they'll
Right.
tank, for a lot of women, they tank your
Low
libido.
libido.
They can cause
Mhm.
weight gain, and so that they're sort of, then you're like, well, now I'm not feeling great for another reason.
Yeah.
So.